Hello, everyone. Thank you so much for tuning in to my channel. Um, and this is the presentation of my health improvement proposal, healthcare improvement proposal. And I'm captioning this Diagnostics Meet Data, Revolutionizing Infectious Disease Care in Southwest Georgia. Um, as you will have read, as we interact on this project, my proposal title is Integration of Advanced Diagnostics and Informatics for Infectious Disease Management in Southwest Georgia Hospitals. And the major objectives of the proposal are to enhance surveillance and detection of infectious diseases in the region, strengthen prevention and control strategies in the area, build public health infrastructure and advance applied research and data integration. So as they putting the problem in perspective in Southwest Georgia. Southwest Georgia is a predominantly African American population, and the rate of chronic diseases is twice what we have in the urban area. In fact, about 40%, the diagnosis times is longer by as much as 40% compared to a metropolitan Atlanta area. And the rate of misuse of antibiotics in rural clinic is double what you have elsewhere. Coupled to that is the fact that delayed care, because people have delayed care in this area due to health system that is not very robust, that's cost people as much as $8 million, an excess of $8 million per year. And this is a map of Southwest Georgia made up of uh, about 14 counties, with the major city within the area being Albany, Georgia, located in Dougherty County. So, what we want to bring on board is like an healthcare performance revolution. And eventually, we want to be able to improve the speed of diagnosis of infections. Um, we want to do this so in such a way that all health systems, all hospitals within the health system within the region will be captured, or will be impacted, will be brought together as a network. But first of all, we want to be able to start from the major hospital system that is headquartered in Albany, Georgia. It's called Phoebe Putney Hospital, from May 2025. Okay, so what are we trying to do? It's actually a matter of data power play. Data is resident or is stored in different sectors, different areas, different places, different types of data that is housed in different places within these hospitals, particularly electronic health records are there. The CDC generated data are there. We can generate data from social pulse, what people are feeling, what the patients that come to the hospital feel. We generate data from this. And genomic sequencing is another source of data, which is not very much popular in our area. So a major aim of this proposal is to be able to find a way of introducing new technology, for example, in genomic sequencing, to already available data, whether within the hospital system or within the government settings, to have access to this data, to integrate this data and analyze this data so that people within Southwest Georgia can benefit immensely in different ways, some of which I'm already highlighting. so that we can speed up the rate of diagnosis, we can reduce the amount of money that is wasted because there is delay and all of that. And part of what I want to do is to use this to be able to integrate these types of data sets within the uh, platforms that are capable of crunching thousands and thousands of records within short time. And we're selecting the AWS Lake as the integration platform to be able to bring together all this kind of data that will be generating. To be able to do this, we know very well that we'll have to train staff. And we aim that by 2026, 90% of our staff will have been trained in the rudiments of managing genomic data sets, managing EHR data sets, managing CDC pulse feeds. Um, some of them we involve understanding of artificial intelligence, particularly machine learning, that will help us to manage large data sets and develop models by which we can make inferences and make predictions. Okay, we want to be able to move away from rusty, traditional healthcare management, infectious disease management system to data-driven, artificial intelligence-driven um, uh, platform that will help the health and wealth, better the health and wealth of our people. Okay, so we want to be able to use this smart approach, um, and eventually using this smart approach, we want to be able to achieve the fact that um, diagnosis can be gotten 30% faster. And that means of within the next 12 months, within 12 months of starting this project, we want to be able to see that diagnosis can be made within 12 months, at least faster by 30% within 12 months. Um, the abuse of antibiotics could be reduced by as much as 25% within the time period. And that, coupled with that, is the fact that we want to be able to see that our staff within the hospital system, they are able to, they know what we want to do, and they are part of it, and they are trained, and they are certified in handling these different types of data sets. Definitely, we are subscribed to EPA and other regulatory system that the government will require us to do to make this happen. Eventually, we want to be able to roll out this program that will cover the whole region by 2027. So again, this is again another way of talking about what we want to do. So again, we want to eliminate the rural specialist buffering kind of desert where things are really slow, where uh, we have to wait for a long time to get things done. Decisions are slow. We want to be able to get away from that. Okay. And our secret weapon will be the data, for example, the data we get from TDC that will combine and integrate with the data we get from our hospital system in the form of the EHR data, as well as the capacity of the AWS platform to help integrate the data together for us to be able to make predictions from them, for us to be able to speed up our process and better the life of our people. Okay, so the idea is that as quick as possible, we want to engage in the training, activating our PDSA cycles, tracking KPIs, and initiating clinician mobile alerts. Okay, so we need a lot of resources, but I know at the same time we know there are going to be roadblocks. But overall, we want to embrace boosters and not blockers. We want to be talking about $2 million worth of cloud credits, Again, as against the rusty 1980s era kind of laboratory technology. Okay. And again, we want to be able to embrace CDC playbooks, doing things according to good standards, like the CDC does, rather than, you know, relegated to the idea of, okay, but we've always been doing it like that, and all of that. We want to be able to encourage people and bring a system in place that move away from the rusty traditional way of doing things to techie way of doing things to more robust way of doing things that has to do with doing things according to new technology and exploiting all available resources to make predictions, to be able to take faster decisions and help the people of the area. Okay, timeline. So basically, by May 2025, we should launch our pilot at the Putney Hospital, Phoebe Putney Hospital in Albany, Georgia. By November of 2025, we should we hope to be able to get to the point of genetic validation, where we are being able to establish the genomic platforms, generate the data, engage the bioinformaticians and infectious disease experts, epidemiologists, and by February 26th, our outbreak surveillance platform should be live. And by February 27, we should actually have a full rollout of this program across the other hospitals within and hospital systems within the Southwest region. Our impact roadmap, we hope that by 2025, by the end of 2025, 5 hospitals are online to do this we're talking about. And by 2025, we've been able to save as much as 20,000 hours of clinician of otherwise of clinician time that would have been wasted otherwise. By 2026, we want to be able to uh, have a system that is in place that will be able to predict as much as 15 outbreaks intercepted early because we are implementing we are utilizing the integrated system of different data sets to make predictions for us, right? By 2026, we want to be to say that our regional surveillance, Southwest Georgia surveillance system is live. In 2027, as we said before, we want to be able to see that we have a full coverage of Southwest Georgia area. Where all the hospitals within the area are part of our network, integrated network. And by the end of 2027, we hope that we will be able to save the region as much as $4.7 million in antibiotic stewardship. So, yeah, we don't want to limit what we want to do to just our uh, counties and our region. Uh, as a matter of prescription for success, we want to be able to move on to recommend this program for neighboring counties or neighboring parts of Georgia, like Augusta and Thomasville. Uh, as a matter of fact, making this happen, we believe, will be a good ground for us to secure CDC innovation funding. And and more importantly, we want to see that at the end of the program, at the end of implementation, we should have trained as much as 115 rural providers, in new technology that will make them serve the people of Southwest Georgia better. And this is the big picture. We want to say we are moving away from reactive care to become predictive health guardians, right? Um, we don't want to wait until there's an outbreak of disease before we react. We want to be able to utilize data that is available to us or that we can explore and exploit within our region to predict health outcomes or to predict infectious disease outbreaks within our region. That's what we want to do. Um, we want to move away from being isolated clinic. Okay, I am this health system, I am this hospital, I am within this town, to a well-connected safety net for our people, where all hospitals within our area are able to connect together, and we can take advantage of available data within all the hospital system within our area uh, to improve the life of our people, to speed up diagnosis time, to manage and save a lot of money with respect to uh, delayed care, to reduce to the barest minimum delayed care using data that we get from the integrated system. All right. So this is actually an invitation for you to come join our diagnostic dream team. Please feel free to scan this QR code where you have access to be able to view our proposal, presentation file, and you see our link to the YouTube that hosts uh, this very um, presentation that I'm giving. Thank you so much for your time. Thank you, thank you, thank you. Special acknowledgements to the instructor and the professor on this course, Dr. Benjamin Ansah. Thank you very much.